CSG, the Galician Health Cluster, is the one coordinating the Galician ecosystem. And just a bit of knowledge of Galicia, we're quite a small region of Spain, part of 2.7 million people, all scattered around, very old, and a very strong healthcare system and social care system that we are trying to put together with the healthcare. We highlighted our Galician ecosystem, especially for being a region in which there's a lot of innovative projects related to healthy, active aging, which now is going to be changing to living because we age once we are born already. And we have a lot of investment in innovation, especially really coordinated by the healthcare system. So we have more than 260 million of public procurement money going for the last 6 to 8 years. And we are the region that moves 40% of the money investment in public procurement, so of innovation. So it's quite highlighted. Who is CSG? So we are a public-private professional platform. Collaborative has to be there. There's no other way. And we aim to transform Galicia into the best region for aging and good health. We like to put activities, action behind the names, the titles. So we do believe in 3 points, 3 pillars, basically: collaboration, innovation, and European projects. So collaboration, we do belong to ECH Alliance since 2015, I believe. And we also belong to Teams since 2018. And we are founders, members of our digital innovation hub related to life science and agriculture, which is that Data Life in Galicia. So this collaboration we really put into practice, and we try to showcase the innovation. We are basically a support platform for innovative projects in healthcare and social care in Galicia. So our main event is RIES, which stands for International Challenges of the Health Ecosystem in Spanish. And we have our 6th edition soon, in the 10th and 11th of November. And we've done all our editions with ECH Alliance as our main collaborator. We are also very keen on European projects, but European projects, just not any European projects, but the European projects that really align to our main interest. So I could say that we have 2 focus. One is more into what we call healthcare, and one is more into what we call social care here in Spain. That is quite divided for the moment, but trying to put the person always in the center. So we have actually currently running 2 that are basically covering these 2 strategy lines: Neuro-Atlantic, which is more the healthcare line, in which we are trying to capitalize the results from research in Alzheimer and stroke into industry, and Inforaja, in which we collaborate with members of team as well, for example, into that deals with really trying to get an impact factor relation of benefit to the wellness of the people, and really checking that the technology is really adopted, used, and is beneficiary for the users. Then we have a new one that is a new European House Europe. That is a big project. And this project is led by the healthcare system together with Galician Health Ecosystem and Galician Health Cluster, in which we've put together 13 entities of our ecosystem together. And we are featuring a project of around 10 million euros for constructing a new concept of a city urban with the backbone of our healthcare building. So it's a quite interesting project that is running into the European program. So what do we offer? So how do we translate these things? So I think we have 2 key things. The CSG has a diverse portfolio of members. This is my cap. That provides strategic partnering, and also we provide strategic relations, because we have a very good public-private collaboration philosophy here. So companies that tend to be interested in investing in Galicia or collaborating with Galician companies usually have access to our ministries, whether it's healthcare, social care ministry, or industry, economic and innovation, through the Galician Health Cluster. So we provide 4 key information packages, I would say, or services: strategic information on our ecosystem and how our regulators work, business support, internationalization, in which we highlight our learning expedition, but also the RIES, the programs of study missions, and then the living labs. And I'm happy to say that since yesterday, they confirmed that we are also going to be the ones managing the government living labs for clinical studies. And we are already the ones managing the living labs for social care studies. So I would recommend you to either visit forumries.com, which is our more international, so to say, window, which is really based on our innovative projects related to our main event, but not only. And then Cluster Saúde is our webpage that we are trying to improve rapidly. And you have my contact there in case you want to contact directly with me. I have to say that we are really putting into practice this collaboration. We're really interested when we go to places and talk to really get to know people. And thanks to ECH Alliance, we've had many good results. InfoAha was also started because of our relation with the ecosystem of Estonia and different activities that we've done. They participated in our RIES in 2017. This is kind of our publicity to say that things happen after these RIES. And actually in the call is Elodie that I didn't know from the call, but I knew through another member of team from Slovenia that put me in contact, and I'm happy to say that we are preparing a call together. So I'm really grateful that things really join together and people are really behind entities, and that's the important thing. I think it's a key factor between our relation with ECH Alliance. So